Actually, I think that trying to find a consensus where there were different views was more of an in-country issue, because maybe two different stakeholders within a country had a different view on whether some change that was going on was good or bad or strategic or not. So as the researchers, we tried to be as objective as possible, and we weren't judging countries' progress towards strategic purchasing or giving a score of A, B, or C. We were just reporting on the facts from a neutral perspective, and I think that helped us not contradict ourselves, and also give justice to all the views that we received from the different informants that we had. And in terms of the data analysis, so we each country researcher plugged in the data into the framework themselves. And even the data analysis process, of course, there's some element of subjectivity in it. So, for example, this information that we found out, where does it fit within the framework? Should we put it in this section or in that section? So as the project coordinator, I was the one who had the big picture view, and I just wanted to ensure consistency across the countries, as I mentioned, to make it easy to compare if people are just having a quick look at our report, for example. But in the end, I have to say we didn't find too many points of contradiction. I think where our stakeholders may have had different opinions from each other would be on issues like what are the next steps to take, what are the challenges that this country is facing. Of course, everyone had their own opinions, and those may have differed. But we just made use of our best judgment. We reported on these as objectively as possible. And in terms of the next steps to take, we see ourselves as facilitators and not necessarily as the decision makers of, oh, this is the next thing you have to do, and this is the priority you have to follow to make purchasing more strategic. We just wanted to have these conversations. We did report for each country what the major challenges are as we see them, and those were informed both by our own desk research and by the conversations that we had. But in the end, as I mentioned, we're acting as facilitators, maybe consulting partners, collaborators with the stakeholders themselves, and we didn't want to make a judgment that contradicted anyone's view of what was going on within a health system.